Welcome back to Jersey Matters. I'm Larry Mendte. The headlines are scary. That a multi-drug resistant superbug is causing what the CDC calls a potential global crisis. And here's the worst part. There's 141 cases in New Jersey. Here to talk about that is Dr. Neeraj Chauhan, who is a PhD professor of microbiology, biochemistry, and molecular genetics at Rutgers Medical School. Thank you, sir. I appreciate you being here.
Thank you for having me.
So what is this?
So Candida auris is a fungus. And before I tell you more about Candida auris, when it comes to diseases, people don't think much about fungus. The first thing that comes to mind is bacteria or viruses or maybe parasites. But fungi as a whole, they kill more than 1.5 million people every year. That's more than malaria. And Candida auris is a type of fungus. And
I saw the mortality rate on this when it gets attached is 60%.
Yeah, anywhere from 30 to 60%, which is very, very, very high. And one of the biggest challenges, CDC is doing a fantastic job in creating awareness about this fungus, is that it's the people who are really at risk are who are immunocompromised, who are elderly, people who are in nursing homes, and those kind of things.
Yeah, we can allay the fears for a large group of the population, because if you're healthy,
yes,
this could get on you, right?
Yep. Mm-hmm.
But it's not going to affect you.
Yeah, I mean, Candida as a genus has about more than 100 species, and not all of them can cause disease in humans. About 20 or so can cause disease in humans. And Candida is a commensal, which means it lives in our bodies. Healthy individuals like you and I, we have it, but generally it doesn't cause any disease. Candida auris, which we are talking about today, is the auris is for Latin for ear, because that's how it was identified in 2009 from a patient from external ear infection. So that's why it's called Candida auris.
So the fungus was inside the ear?
Yeah, inside the ear.
And then they found out it wasn't just an infection, it was this fungus that was in there. And that was in 2009?
2009.
How quickly has this spread since then?
This is remarkable. Just 10 years now, from single patient in Japan, now this has been identified in more than 30 countries. Perhaps it's more because, maybe CDC or other organization, they have not looked at other countries. So at least more than 30 countries have reported cases of Candida auris infection, including US. And here in the US, the three most, and the states where most infections have been reported are New York, New Jersey, and Illinois. But it's there in other states also.
So it seems like the real concern is the carrier of it, right? The real concern is that a healthy person may have this fungus and not know they have it.
Yes.
And then visit someone in a senior care, visit someone in the hospital who has a low immune system, and they are susceptible to some very serious consequences.
Absolutely. That's something which is not known. Why this fungus sticks to surfaces so much, because it sticks to, and it can colonize a normal person on their skin, and if I get it, potentially it will not cause me any disease, but I can transfer to someone else who's sick. And likewise in hospitals, it can contaminate other surfaces, and so that's a concern.
So there's 141 cases right now, and that means it's people that fall into the demographic you were talking about who have low immunity. But that would mean that there are hundreds of more people who have the fungus.
Absolutely.
Do we know what the numbers would be?
That's difficult to say, because that is something we don't know. I'm pretty sure the number is much, much higher. These are the cases which are confirmed by CDC. I'm sure there are more than 141.
There have to be, right?
There have to be, yes, absolutely.
There would have to be, and you have no idea you have it.
No. Unless, someone performs a test. That's another problem, because, the diagnostic tests which are available for identification of Candida auris, they were not that good. It was misidentified as something else. And later on, when people discovered that, this is auris, so now there are tests which can identify Candida auris.
Is there anything that people can do to prevent getting this fungus?
Yeah, CDC recommends this, and I think the best thing is to have a good hand hygiene, wash your hands, and yeah.
Is that where is the hands that it
Yes.
comes from?
Yeah, I mean, potentially if someone has on the skin, because hands is not what we use to interact with people, so there is a good chance that one can transfer it to other people.
Yeah, because I guess I was thrown off by the ear, but of course if somebody has an ear infection, they're going to touch their ear, and
Yeah.
then it's going to be in their hands, and then they're going to transfer it onto somebody else.
Yeah.
Now, I was struck by the fact that it said multi-drug resistant.
Yeah.
Doesn't say all drugs.
Well, it's getting there. So for fungal infections, unfortunately, there are only 3 classes of drugs. And so that's not a lot. And Candida auris tends to be multi-drug resistant, which means it's resistant to more than one class of antifungal drugs. Now, there are some cases, at least 2 cases in the US, which are shown to be pan-resistant, which means it's resistant to all antifungal drugs. So, which is why it's really, there's a need to develop a new class of drugs.
Is there a drug that works, are you saying?
Yeah, there's a class of drug which works. It's called a kinokinin class of drug, which is generally used for treatment of Candida auris infections. But again, those infections which are pan-resistant, it will not work against those drugs.
Why is the mortality, if there's a drug that works, why is the mortality rate so high?
Well, again, the patients are very, very sick. They are not
So
like
it may
healthy.
not be the cause.
Exactly.
It may not be the cause of death, but it makes whatever they have
Absolutely.
that much worse. Should we, as a population in New Jersey, be concerned about this now? Is it to the point where this is going to extrapolate quickly?
Well, I mean, should be concerned that, it's good to have, awareness, which I think is fantastic, which, that's why we are talking about it. So people should be aware of it, but there is no need to be panic, that about this fungus. Because generally, as I said, healthy people, are okay.
Right, and I saw that where it said public awareness is crucial in this. This is the CDC that's saying it's crucial.
It is very crucial.
But if you don't know you have it and there's not much you can do except wash your hands, what does public awareness do exactly?
Well, I mean, public awareness in the sense that, generally, again, a healthy individual will not develop disease. But again, if they have someone in the family who's sick, and if they go to hospital to see a patient or a nursing home, so there I think they need to be careful.
And don't even know they have it.
No. Yeah.
That's
Exactly.
That's the problem with all this. I would imagine that they're trying to work on something that's going to beat this. But has that been going on now for a while?
Yeah, I mean, a lot of scientific community, people are very actively working on it. In my laboratory, we're also working very actively trying to identify the mechanism which makes this bug drug resistant, and also why it colonizes so much better compared to other Candida species.
Right.
Yeah.
Well, thank you. Good luck on their work on that. I really appreciate you coming in.
No, thank you for
very
having
much.
me. Yes.
Dr. Neeraj Chauhan, PhD, Professor of Microbiology, Biochemistry, and Molecular Genetics at Rutgers Medical School. When we come back, there are thousands of heroes in New Jersey. Sometimes they get recognized. We'll introduce you to one when Jersey Matters continues.